Our first presenter for today is Mr. Bemhemba. He is a certified dental therapist. He obtained a mini master's in public health, postgraduate diploma in epidemiology and control of communicable disease from the Abubakar Tafawa Balewa University, OHI. Currently working with NKST College of Health Technology, Anka, Boko, Benue State. He is a fellow ORAPOSIUM College of Scholars. Bemhemba will be presenting on the topic measuring oral health, the oral health index. Mr. Bemhemba, if you can hear me, you can proceed with your presentation. Thank you.
Good evening, everyone. Good morning, everyone, if you can hear me.
I can hear you clearly.
Good morning, sir.
Good
morning, we can hear you.
I'll be sharing my screen so that we can. Good morning, my name is Bemhemba. I'll be presenting measuring oral health, the oral hygiene index. The outline I will use for this presentation will include introduction, dental indices used for measuring oral health, oral hygiene index.
Sir Iba, good morning.
Yes, good morning, ma'am. My speaker? Am I hearing her? Hello?
You can proceed, sir.
Okay, I can proceed.
Yes, sir.
You can.
It's okay. So, by the outline we'll be looking at will be the introduction, dental indices used for measuring oral health, oral hygiene index, and we'll look at the references. By way of introduction, oral health is a key indicator of general health, well-being, and people's quality of life. The measurement of oral health is based mainly on clinical indicators. These indicators are responsible for the quantitative measurement, scoring, and analysis of dental conditions in individuals and groups. An index is an expression of clinical observation in numerical values. In the context of oral health, an index describes the status of individuals or groups with respect to their oral health. Dental indices can be simple, measuring only the presence or absence of a condition, or cumulative, measuring all evidences of a condition in past and present. The indices used for measuring oral health are grouped into four. We have those for oral hygiene assessments. That's where we have the oral hygiene index and the simplified oral hygiene index. Those for gingival and periodontal disease, we have the gingival index, the community periodontal index, and the periodontal index. Those for caries, we have the decayed, missing, and filled teeth, that's the DMFT. And indices used in dental fluorosis, we have the jeans fluorosis and the community fluorosis index. For the sake of this study, we'll be looking at the oral hygiene index under oral hygiene assessment. The oral hygiene index, it was developed by John Green and Jack Vermeulen in 1960 for the classification and assessment of oral hygiene status. That's the basic rule oral hygiene index plays assesses oral hygiene status. It is composed of two components, the debris index and the calculus index. The dentition is divided into 6 sectants for scoring with the facial or buccal and lingual tooth surface in each sectant, which is covered with the greatest amount of debris or calculus selected. 12 surfaces will be evaluated for this index. For us to get the 12 surfaces we're interested in, we have to get a criteria. The criteria for selection involves the following. Only fully erupted permanent teeth are scored. In this very index, third molar and incompletely erupted tooth teeth is scored. The buccal and lingual debris or calculus scores are both taken on the tooth in the segment having the greatest area covered by either debris or calculus. Look at the diagram by the right-hand side. You see there are the areas selected, the 6 sectants, 6 segments that we'll be using for this index. We have the anterior section for lower teeth, posterior for the left, posterior for the right, anterior upper teeth, posterior left, posterior right. The debris index, we want to get the debris index. If the score is 0, it indicates that no debris or stain is present. Look at the top right-hand side of your screen. You look at the tooth that is supposed to be a canine. The score there is 0. When you look at the tooth, the color is whitish completely, indicating that there's no debris or stain present on that very tooth. The next tooth has a score of 1. If you look at the diagram, down beneath the tooth, you have a whitish area very close to the gum, around the gingival, close to the gingival one, the tooth, the 1/3 of the tooth, you have a black coloration there, indicating the presence of soft debris around that area. So score 1 is soft debris covering not more than 1/3 of the tooth surface or presence of extrinsic stain without either debris, regardless of the area covered. The second score, score 2, indicates soft debris covering more than 1/3, but not more than 2/3 of the exposed tooth surface. You look at the diagram indicating number 2, that should be the central incisor, and it covers more than 1/3, but not up to 2/3. The one scoring 3, debris covering more than 2/3 of the exposed tooth surface. And you look at the color, the black color extended very down with the whitish color very small in the middle. That's how we assess the debris index. For the calculus index, the diagram is still on the top right-hand side of the screen. Score 0 indicates that there is no calculus present. Score 1 indicates that there's supragingival calculus covering more than 1/3 of the exposed tooth surface. Score 2 indicates supragingival calculus covering more than 1/3 of the tooth, but not more than 2/3 of the exposed tooth surface, or presence of individual flecks of subgingival calculus around the cervical portion of the tooth, or both. Score 3 indicates supragingival calculus covering more than 2/3 the exposed tooth surface, or a continuous heavy band of subgingival calculus around the cervical portion of tooth, or both. How then do we calculate either the calculus index or the debris index? To arrive at the oral hygiene score, which is actually what we're interested in, we first of all look at the debris index and the calculus index. Thus, we look at the scores for both. And we do that by dividing the total score of each tooth by the number of sectants. The debris index and calculus index are then summed up to obtain the oral hygiene score. For debris, our DI, that's debris index, will be buccal surface plus lingual surface all over number of segments. Now, when you look at the criteria, for the first table there on the lower part of your screen, right-hand side, you see the right. That is the posterior aspect of the teeth. There is a buccal surface and there are lingual surfaces. For the upper teeth, The buccal surface is indicating 3 for the first one, indicating that that's to tell you that they're scoring 3 because the portion of the tooth affected with debris is more than 2/3 of that tooth surface. That is why it has the number 3. When you go to the lingual surface, ideally for upper teeth, we should be looking at lingual surface. It should have been palatal surface, but we're looking at lingual surface here in the generic form. So lingua or palatal, they're just going the same. Ideally, it should have been lingua there. You have 1 indicating that there is a presence of stain or there is debris that cover just around the 1/3 of the tooth. Anterior, you have labia and lingua with 2, 2. Left, we have 2 and then 1. That's for posterior surfaces for the left side of the dentition. For the lower teeth, you can see the scores indicated there. A total, when you add buccal upper and lower teeth, for the buccal surface, you have 5. For the lingua, you have 3. For the labia, you have 3. For the lingua, you have 3. For the buccal, you have 4. And for the lingua, you have 3. Now, how do we get this summed up? We're told that we'll add all the buccal surfaces. Look at the surface written buccal. For right, you will see buccal, total is 5. Anterior, there is no buccal, but actually labia and buccal are the same. The outer external surfaces. So labia and buccal, where you are not seeing buccal in anterior, but you are seeing labia, buccal is going to serve there. So we're going to have 5 plus 3. When you go to the left, you have buccal, which is 4. 5 plus 3 plus 4 will give us 12. That sums up buccal surface plus lingual surface. Lingual surface, thank God that we have all the linguals are there. Lingua is going to be 3 plus 3 plus 3, and that is going to be 9. So our debris index is 12 plus 9. But remember, we use 6 segments, and that will be divided by 6. The answer will be 3.5. That is the debris index for this particular dentition. For calculus index is the same idea, the same thing we're going to use, but this time around, of course, it's just the same presentation. Buccal surface, look at buccal, look at labia, look at buccal again. You now add them 1 plus 0 plus 1. That will be 2. For lingual surface, you have 1 plus 2 plus 2 under the totals, and you have 5. When you divide them by number of segments, being 6, it's going to be 2 plus 5, which is equal to 6, and that is 1.16. But we're told that oral hygiene index is a summation of debris index and calculus index. When you sum 3.5 with 1.16, you have 4.66. What then is the interpretation? How then, what the 4.6 is, what does it mean to us? The debris index and calculus score ranges from 0 to 6. Maximum score for all segments can be 36 for debris or calculus. OHI ranges from 0 to 12. So the higher the OHI, the poorer the oral hygiene of the patient. For ours is 4.66, indicating that it is not good. Maybe we can look at that as being fair. It's not very, very poor because it is not up to half of 12. If there was around 6, we would have known. So 4.66 is not very bad, but it's not very good as well. It's around the middle. So that is the OHI of that patient. Maybe we can choose to say it's fair. By way of conclusion, oral hygiene is essential for general health and mirrors the entire health of the body. Oral hygiene index plays a pivotal role in the measurement of oral health. Not only does it show patients' oral hygiene status, it also expresses the presence of food debris, dental plaque, and material alba on the dentition of patients. Thank you. Thank you.